Thank you for being here. My name is Charlie Hunt. I serve as the Director of the Johnson County Department of Health and Environment. And I just want to welcome you to this evening. We really appreciate you coming out and devoting some of your time regarding this situation. We have several goals for you all tonight. First of all, we want to provide some just general information about tuberculosis so you kind of know what it is we're dealing with. And then we also want to provide you a little bit of information about what we've been doing in terms of identifying the students and faculty and staff who are potentially exposed, and then also want to let you know kind of what to expect moving forward. So we have several staff here from the department that we're going to be meeting about. If you have questions after the formal part of the presentation and discussion, please feel free to reach out to any of us. But in particular, I want to recognize a couple of people at the table here. You're going to hear from them in just a minute. First is Gabby May, our TB nurse. Gabby's been working tirelessly, as have a lot of the other staff on this situation, and I just want to recognize her and all the hard work that she's been doing. And then we also have Dr. Lee Lukeroth, who is here with us tonight. Dr. Lukeroth has worked as a staff physician with the University of Kansas at Lawrence, starting in 1993. And in that role, she was in charge of TB screening and treatment for the university. And Dr. Lukeroth currently serves as the Johnson County TB consultant, and will be attending a national TB conference here in a couple of weeks at the Mayo Clinic in Rochester, Minnesota, and which happens to be the Regional Center for Excellence for the state of Kansas for tuberculosis. So Dr. Lukeroth has a wealth of knowledge, and I'm going to turn things over to her and Gabby, and we'll go from there.
So basically, tuberculosis is caused by a bacteria, Mycobacterium tuberculosis. It usually attacks the lungs, and when it attacks the lungs, that's how somebody becomes infectious. But TB can go anywhere in the body. I have personally treated TB of the skin, TB of the lymph nodes in the neck. Those people can't give it to anybody else, but if you don't treat them, they're going to go on, and the TB is going to go other places and can eventually end up in the lung. As I've worked with Johnson County as a consultant, we've had cases of TB in the eye, we've had TB meningitis. So just remember, TB can go anywhere it wants to go. Not everyone who's infected with TB becomes ill. So just like my multi-drug resistant case back 20 years ago, that particular patient had absolutely no symptoms. We caught them at the beginning of their infection. It was just that they had been exposed to a resistant bug. This next slide is just about TB transmission. If you're exposed to someone with active TB, the TB bacteria are spread into the air by coughing, talking, singing. If everybody was always outside and there was wind, your exposure is going to be low. But if you're in a small room, there are no windows, the door is closed, there's somebody in the room who has active TB, and they cough, and you're around them for a period of time, depending on how infectious they are, that is how somebody is exposed to TB. The aerosolized germs are inhaled by, somebody gets deposited in their body. Once again, the factors that determine the TB transmission are how infectious the person is who's coughing. If they have a high load of organisms in their lung, they're going to spread out more bacteria. The environment of exposure, once again, in a closed environment, you're going to have a much higher chance of, inhaling enough bacteria that you then have been exposed. And the length of time. If you're only around somebody for 1 second versus an hour, the exposure is going to be different. And then the last thing is just how potent the organism is. As we said, prior to 20 years ago, we did not have drug-resistant TB in Kansas. But things have changed. Now we have lots of multi-drug resistant cases. So all of that is taken into consideration.
We always like to point out here too that, you know, tuberculosis is a lot harder to get than like the common cold or COVID-19. So it does take that prolonged exposure. We look at the environment in which that happened.
This is probably the most important slide, and it's the difference between TB infection and TB disease. So TB infection, the medical term, we're always using latent TB, but that's not an easy term for most people to understand. Basically, in TB infection, there are TB germs in the body that are sleeping, totally asleep, they're not doing anything. Their TB test will be positive, but their chest x-ray is usually normal. And if you do sputum, smear, and culture, it will be negative and they will have no symptoms. So this particular person is not infectious. They cannot give anything to anybody else. It's only when they go on to develop TB disease, which means they are actively sick, so they have active TB disease. Once again, they have the TB germs in the body, it's just that they've been awakened, and the TB result is positive, but now the chest x-ray is usually abnormal. The sputum, smears, and culture will be positive, and usually they have symptoms, and I do want to just spend kind of a moment talking about symptoms. When people get sick with pneumonia or a really bad cold, they get sick very quickly. Tuberculosis is much more gradual. So somebody can be coughing and they're still coughing in 3 weeks, but now they're coughing in 6 weeks, and that's kind of with the progression of their tuberculosis. So the same thing, they can be tired, but after a month they're more tired. They can lose 2 pounds, then in another month they've lost 5 pounds. And so it's this kind of slow, steady progression. The only time that we have people coming in sooner is we can have people that are not that sick, but they cough up blood. Well, if they cough up blood, they come right in the door. But the other people, you know, they might think, oh, I'm going to get better, you know, and I don't have time to go to the doctor. So a lot of times there is a delay in the diagnosis of active TB because everyone has to think about it instead of thinking, well, this is a cold or this is pneumonia. So these people are infectious. They definitely can spread the bacteria before treatment has been started.
Yeah, so TB infection is not uncommon. Over 1/4 of our world population has actually been infected with tuberculosis. These patients go asymptomatic for a period of their life. So it's not uncommon, we have seen it.
Contact investigation part of it.
Okay, so with a contact investigation, that begins immediately when we receive confirmation that a patient has been diagnosed with active tuberculosis. And in this case, school classmates were determined to be exposed, and the school provided the list of contacts. An email was sent out notifying the staff and students of exposure, and then a follow-up email was sent for the consents for the TB blood test. So if you haven't filled those out yet, please do so. The first clinic will be held on October 12th, which is next Thursday, just a week away. And then our second testing clinic will be taking place on November the 14th. This participation in the second clinic is based on the results of the first clinic and the date of the last exposure for your student or staff. So what you can kind of expect at the testing clinic, there will be local and state health department staff present. There will be a blood draw for each contact, and then we will also have EMS on site assisting us for anyone that would need emergent medical attention. Please make sure that your student drinks plenty of water the night before. Also make sure that they have a good breakfast the day of the clinic. We will be providing snacks outside in case they forget.
So test results, so from that initial blood draw, the test results will hopefully come back either negative or positive. If they come back negative, that means TB infection is unlikely. A second test may be necessary based on the date of the exposure of your student, okay? Because everything is about dates and timing. The results will be mailed 7 to 12 business days, so it doesn't come back immediately quickly. So based on how quickly the state lab gets the test result and it's processed, then once again, the results of the letters will go out. At the end of the slides, there's going to be an email that will kind of help keep everybody updated on that as well. On the other hand, if somebody has a positive test, they have most likely been infected with TB, been exposed to TB, and now their test is positive. Their results will be given by phone in 5 to 7 business days with information on what to do next. Once again, this is going to be based on how quickly everything rolls through getting completed. So if the blood test is positive, a chest x-ray is required. That's the gold standard of figuring out what's going on. So based on the chest x-ray is what then the recommendations will be made on how to proceed, and depending, baseline lab may be ordered at that time. There are 3 treatment options for treatment of latent TB. Once again, this is somebody whose x-ray is normal, okay? And so for the treatment to prevent future active TB, you can either take a drug called isoniazid daily for 6 to 9 months, rifampin daily for 4 months, or isoniazid plus rifapentine once a week for 12 weeks. This particular option does require that the nurse observe the person taking the medication weekly, because it's just really important to make sure that those doses are taken correctly.
So treatment for TB infection is always highly recommended, okay? And just like in 2015, we had a very good response. The students tolerated the treatment very well, and we were able to monitor them and make sure they were successful in completing the treatment. So for any additional questions or concerns, you can always refer to the CDC website. We also have a website on our JOCO.gov that you can refer to and that we can post updates to as well.